Over a year and a half, that's how long medical professionals are predicting it will take to clear up a backlog of surgeries at hospitals across the province. Surgeries were initially put on pause when the pandemic first hit to help ease hospital resources, and now experts say that they have a lot of work ahead of them. Over 148,000 surgeries now in limbo, a backlog created when the provincial government canceled and postponed thousands of elective surgeries to free up hospital resources at the height of the pandemic between March and June.
Well, it's a message. Right. It's a message of the challenge that we face. It's a message of how we need to think about innovative ways that we can think of to clear the backlog.
A report by the Canadian Medical Association Journal says of those 148,000 surgeries, about 5,000 were for cancer and 1,000 were for cardiac-related operations. The majority were for benign surgical procedures. Experts predict that it will take 84 weeks to clear that list only if there's a target of 717 operations being conducted per week.
Well, there was a decrease of about 38% in cancer surgeries. There was a reduction of 96% in benign surgeries, meaning non-cancer, non-cardiac, or non-critical surgeries.
Dr. John Irish says his team calculated how long it would take to clear the backlog if only focusing on priority time-sensitive surgeries. He says it would still take 14 weeks before putting a dent on that list alone.
Even now, obviously, as we come out on the other side, as we recover from at least the first wave of the pandemic, we continue to prioritize our patients appropriately.
Experts say while the list of surgeries that need to be completed is high, there are lessons to be learned from this experience.
I'm not saying we know everything, but we know more, and so we can be much more aggressive about planning and mitigating and reducing the effects on the rest of the healthcare system should subsequent waves occur.
Researchers in this study say that this data is important for future planning, especially if a second wave does hit. Now, health officials say that we can't simply go back to business as usual when it does come to the healthcare system to avoid further impact on patients. Melissa Nakhavoly, City News.
We're going to see the wet weather overnight continuing in